Semaglutide works by treating the disease of obesity at its origins. And of course, once you treat the disease of obesity, it comes under control. And the consequence of this is weight loss. Now, initially, the weight loss happens at over approximately a year's time, and then it stabilizes in the long term as long as you are taking the medication. Now, of course, all medications have side effects, and semaglutide is similar. Initially, people may feel nauseous, but the nausea will settle. Other patients may have constipation, but if that happens, please let us know because we can easily manage it with lifestyle changes, such as increasing water consumption, giving you more fiber to eat, or even improving your bowel habits. Finally, a significant amount of weight loss, whether or not you get it with a diet, medication, or surgery, can be associated with gallstones. It's very rare. Only 3 in 100 people may get gallstones. A very rare complication of gallstones is pancreatitis, maybe 2 or 3 in 1,000. But if that happens, we stop the medication with no long-term sequelae. Mysimba is a combination of 2 old medications, naltrexone and bupropion. And we've been using these medications for decades, so we're very comfortable in knowing how they work and what side effects to expect. When you combine these medications, what happens is people feel less hungry and they have fewer cravings for food. It only works in about 1 in 3 people, and the weight loss on average is about 10%. It works inside the brain, the part of the brain that has the disease of obesity, and hence why it is so effective. It does have side effects, which includes that people may feel nauseous in the beginning, but again, the nausea will settle down. Other people may have insomnia, trouble sleeping at night. And that's why we only give the tablets in the morning and at midday, never in the afternoons or the evenings. Now, people who have epilepsy can't take this medication because it can increase the risk of convulsions. But epilepsy is luckily very rare in patients with obesity. And finally, if we use medications such as selective serotonin reuptake inhibitors for the treatment of depression, we may have to adjust the doses to make sure that there's no serotonin syndrome. Orlistat is the medication that we've been using for more than 3 decades. This tablet only works inside the gut. It is not absorbed into the bloodstream, and therefore it has no side effects. But the effects of the medication is it blocks about 1/3 of the fat that you eat. So if you eat a large amount of fat, then 1/3 of that is going to come out the South Pole, and it's going to cause terrible, terrible diarrhea. It's a type of diarrhea that you think you need to go to the bathroom, and it's already too late. However, you are in 100% control, because if you put less fat in your mouth, then you have no diarrhea, and only then do you lose a substantial amount of weight. So what orlistat really does is it helps you to make the right choices. So therefore, we think of it as changing you from mindless eating to mindful eating. Patients often ask us why this weight loss plateau, and it often plateaus higher than they would like it to plateau. Now, the reason is that the treatments we have are for the disease of obesity, and the treatments, when they are effective, puts the disease under control, and therefore the weight loss is a consequence of how well we are controlling the disease. Now, unfortunately, we cannot predict how much weight somebody will lose before we start the treatment, but we can predict certainly 3 months into the treatment. But ultimately, the weight will stabilize. And sometimes patients feel that this means that the medications are not working anymore. Actually, quite the contrary. The medications are controlling the disease, and hence the disease is stable. Now, if we stop the medication, what happens is the disease relapses, it comes back, and as a consequence of the disease coming back, patients become more hungry, they feel less satisfied, and they gain weight in the long term. So our aim is not weight loss, it's health gain. But the way to maintain optimal health gain is to have long-term weight loss maintenance. And that is now possible with our treatments.